The last thing I remember from my normal life was my wife crying, "Bus!" as I watched the fender of the bus crash our bike and both of us. I can still remember slamming into the bus and feeling my head change shapes as the bus's grille came into contact with us at 60 miles per hour. Our bodies hit the bus, and I sensed a cushion between the bus and us. As impact ended, I remained down on the asphalt. I was told by the couple who called 911 that I was 10 feet from the bus. I suffered a degloving of the left leg, which required several surgeries during my 2 weeks in the hospital, a closed head injury, and ruptured and torn discs. My wife's leg was almost almost had to be amputated, and she required 8 units of blood. On July 13, 2008, Mike and Leslie Veal were hit by a bus while riding a motorcycle in Annapolis. They were taken to shock trauma and treated for their multiple injuries. Stories like these make the need for donation of blood and blood products clear. Today, I would first like to speak with you about the need for blood products. Next, I want to speak with you about the common misconceptions of blood donation. Then finally, talk about the types of blood donation and what to expect during donation. In order to understand why we need to give blood, we first need to understand why transfusions are necessary. The World Health Organization illustrates that blood transfusions save lives and improve health, but many patients requiring transfusions do not have timely access to safe blood. The need for blood transfusions may arise at any time in both urban and rural areas. The unavailability of blood has led to deaths and many patients suffering from ill health. There are many reasons people receive blood transfusions, including surgery, injury, and disease. Loss of blood during surgery or as the result of an injury may result in decreased red blood cells and may require a transfusion of red blood cells. Cancer may decrease your body's production of red blood cells, white blood cells, and platelets by impacting organs that affect blood count, such as the kidneys, bone marrow, and spleen. Drugs used in chemotherapy can also decrease components of blood. Blood transfusions may be used to counter such effects. Some illnesses cause your body to make too few platelets and clotting factors. You may need plasma or clotting factor transfusions to make up for low levels. People with blood diseases and those undergoing stem cell transplants as a part of treatment of such diseases may receive transfusions of red blood cells and platelets. A transfusion of albumin, a blood protein, may be given to help treat some types of severe liver problems. Research shows that on average, a hip replacement typically uses 1 unit of blood, a cardiac bypass requires 2, a heart transplant requires 2 units, and a liver transplant 6 units of blood. People may have misconceptions about the blood donation process. The American Red Cross explains that the donation process from the time you arrive until the time you leave takes about an hour. The donation itself is only about 8 to 10 minutes on average. After the donation, it is not necessary to stay all day. After 10 to 15 minutes, you can leave the donation site and continue with your normal daily activities. The donation is not very painful. The American Red Cross suggests to pinch the fleshy, soft underside of your arm. That pinch is similar to what you'll feel when the needle is inserted. You cannot contract HIV or other viral diseases by donating blood. Sterile procedures and disposable equipment is used in all Red Cross donor sites. Needles are only used once and then disposed of. Another common misconception is that the American Red Cross does not have strict eligibility requirements. It is necessary to be 16 years old in some states with parental consent or be at least 17 years old. Weigh at least 110 pounds. Be healthy, which means that you feel well and can perform normal activities. If you have a chronic condition such as diabetes, healthy also means that you are being treated for the condition and it is under control. Other restrictions on certain medications and diseases may apply. The need for blood products is great, but how can we help? By donating blood products. The donation process. Every blood donor is given a quick physical exam. This includes checking temperature, blood pressure, pulse, and iron levels to ensure that it is safe to give blood. After the donation, refreshments are given. Possible types of donation, according to the American Red Cross, can include whole blood donation. This is the most common type. Approximately a pint of whole blood is given by the donor. You are eligible to donate whole blood every 56 days. During a platelet apheresis donation, an apheresis machine collects platelets and some plasma and returns the red cells and most of the plasma back to the donor. A single donation of platelets collected by apheresis can constitute one or several transfusible units, while it takes about 4 to 6 whole blood donations to constitute a single transfusible unit of platelets. The donation approximately takes 1.5 to 2.5 hours. Only certain American Red Cross centers can collect platelet donations. Plasma. Plasma is collected simultaneously with platelet donation and is only collected again at select American Red Cross donation centers. Only donors with type AB blood can give red cells to another AB recipients. They are the universal plasma donors. The right type donation for AB donors may be an apheresis donation of plasma or plasma and platelets. Double red cell donation is done with the help of an apheresis machine, which collects the red blood cells but returns most of the plasma and platelets to the donor. The donor needs to meet slightly higher hemoglobin and body height and weight requirements in order to be able to give a double red cell donation. Double red cell donations take approximately 30 minutes longer than whole blood donation and allow you to give 2 units of red cells. Donors are eligible to give double red cells every 112 days. The American Red Cross has tips for successful donation. Before your donation, maintain healthy iron levels in your diet by eating iron-rich foods such as red meat, fish, poultry, beans, spinach, and iron-fortified cereals and raisins. Eat healthy meals before your donation. Avoid fatty foods such as hamburgers, fries, or ice cream before donating. Fatty foods can affect the levels of your blood. If there's too much fat in your blood, your donation can be tested or cannot be tested for infectious diseases and the blood will not be used for transfusion. Drink an extra 16 ounces of water or non-alcoholic fluids before the donation. Get a good night's sleep. Remember to bring your donor card, driver's license, and 2 other forms of ID. During the donation, wear clothing with sleeves that can be raised up easily above the elbow. Relax. Listen to music, talk to others, or read during the donation process. Afterwards, take the time to enjoy a snack or a drink in the refreshment area. Following your donation, you should drink an extra 4 8-ounce glasses of liquids to avoid alcohol over the next 24 hours to stay hydrated. Remove the wrap bandage within the next hour. Keep the strip bandage on for the next several hours. Do not lift anything heavy or do vigorous exercise for the rest of the day. If you experience dizziness, lightheadedness after the donation, stop what you are doing and sit down until you feel better. Again, avoid performing any activity where fainting may lead to injury for at least 24 hours. We discussed the need for blood products and how it can help, and now we will talk about the donation. An adequate and reliable supply of safe blood can only be assured through a stable base of regular voluntary, unpaid blood donors. The World Health Organization, WHO, explains that they are the safest group of donators because of the prevalence of blood-borne infections is lowest among them. The WHO urges member states to develop a national blood system based on voluntary, unpaid blood donors to achieve the goal of self-sufficiency in safe blood and blood products. This goal is only achievable through voluntary donations from people like you. There is always someone who needs a blood transfusion. After discussing the need for blood products, the common misconceptions, and the type of donations, I hope you feel more comfortable with giving blood. The need for blood products is constant, and your contribution is important for a healthy and reliable blood supply. And you'll feel good knowing that you've helped save a life.